turning now to this expanded view of community development. I understand this expanded role. First, we need to hear from you how you define it, what it might be, but why apparently is it also maybe kind of controversial?
Well, I think it's sort of, change is always difficult, I think. But I think if we're going to be honest with ourselves in community development, we can look at the poverty numbers. We can even look at some things that are more specific to our industry, like the Department of Housing and Urban Development does a study on worst case needs, whether or not somebody is living in a crowded environment or paying too much for their shelter. And those numbers are not going in the right direction. And so we need help. Those of us who work in community development, we need new partners, we need new ideas, we need new resources. And so that means changing the way we do our business, and that's unsettling to some people. And it may mean we de-emphasize some of the existing system and introduce new elements, and that's going to be disruptive.
So tell us about these new elements. What might they be? Where are you going for partnerships?
Yeah, well, so it's interesting. We had Melody Barnes she was the director of the Domestic Policy Council recently rolled off in the Obama administration. She spoke at one of our conferences where we try to bring the people who worry about public health together with the people who do community development, and those have been very successful. And she says, look, you don't wake up and say, I'm going to have a transportation day today, and then tomorrow wake up and say, I'm going to have an education day. You wake up every day with an everything day, right? And so that's the issue. We've got to sort of branch out these to understand our other service providers, whether they focus on place, the way community development does in terms of building the buildings, the apartments, the clinics, the schools, the grocery stores, and the people who focus on people, things like Head Start and education and job training and healthcare and health promotion. So we need to start bringing those two groups together.
The health and the housing, or the education and the health.
Right, and it gets complicated because you want to bring everybody together, but it can't be so big that we are this lumbering group that can't execute on anything.
Right.
So we're thinking more strategically focusing on a few institutions like health as being some of our first partners in our work in trying to reduce poverty in low-income communities.
And so, am I hearing you correctly? Are you saying that you're hoping to set as your goal and your metric reducing poverty?
It is.
Tell me more about that.
Well, so it's interesting. One of the articles in the book is an essay is by Radner and Shonkoff, and they write this piece about setting stretch goals. And I think one of the things we struggle with in community development is for too long we focused on outputs and not outcomes. So we're very good at counting the number of apartments we've built. We're very good at counting the number of loans that have been repaid. These things that we are I don't want to diminish it by saying they're widgets. They're important objectives to achieve, but we don't know how much they affect these bigger issues that we really care about, why we all got in this business in the first place, like reducing poverty and making communities work better. And so what we need to start doing is focus on what Radner and Shonkoff call stretch outcomes. And so one of our stretch outcomes is we're going to sort of make the goal. We're going to reduce poverty by a half in a particular community, or make sure that every child arrives at kindergarten ready to learn, and hold ourselves accountable to that.